Ladies and gents, welcome back, or should I say, welcome me back to my own channel here. I've been here in Japan for the past few weeks, and I'll be here a few more weeks until the 20th, and that's when I return back to Canada, and things will go back to normal and me doing my videos every morning. Now, I wanted to get into a bit of a story about COVID-19 and how things have been going for the long-lasting effects, not long-lasting health effects for people, but the long-lasting government intervention effects that have been going on in Canada and around the world. Hey, I'm in Japan, and they're still requiring these things at most places until the 13th of this month, and then Japan can be free of the masks in virtually all spaces. I got here using a PCR test, not proof of vaccination or anything like that. And in Japan, they never required you download an app onto your phone. It was just a website that you don't have to keep a lasting impression of and have yourself be tracked while you're in the country. A little less invasive here than it was in Canada, but there still are lasting effects in Canada, and this is some of the stuff I wanted to get into today. Now, this is from True North News. Public Health no longer advising boosters for most Canadian adults. So this thing that they were talking about of being up to date and that being a mandated thing moving forward in perpetuity, I think is largely unpopular, and they're moving away from. Canada's vaccine advisory says many Canadians should not inject a COVID-19 booster this spring. In a Friday statement, the National Advisory Committee on Immunization recommended spring booster shots exclusively to at-risk groups, including those over the age of 80 and those who are immunocompromised. So they're still recommending to people who they believe ought to have these shots, but they're not recommending them to everyone, including children, I guess, as they were trying to enforce and push on healthy individuals who just wanted to take their own risks and make their own decisions about their own well-being and health. This is no longer being pushed on Canadians any longer. This is a new thing, but we still have the things that we're living with. The former municipal employees launched a $125 million lawsuit over the vaccine mandates that were lifted in Ontario. But this is several former municipal employees from municipalities across Ontario, including locally, have filed a $125.9 million class action lawsuit in connection to the province of Ontario's COVID-19 vaccine mandates, which the plaintiffs claim were unconstitutional. I think a lot of people that follow this channel would agree with that wholeheartedly. And a lot of people that follow this channel got their start following this channel because of the convoy when it took off and my coverage of that. And a lot of people agreeing with what the convoy stood for in fighting against these mandates that were detrimental to people's livelihoods. I mean, they were talking about in putting these mandates in place to help people's lives, like their health, imposing upon them these mandates to protect their health. The arguments were that it was going to be more detrimental to people's livelihoods than people's health in any meaningful way. In a statement of claim signed on February 16th, the plaintiffs, who are represented by Toronto lawyers Rocco Galati, said that the sending home of unpaid leave and or firing the plaintiffs for declining the COVID-19 vaccines were and continue to be unconstitutional and of no force and effect. And this has been proven time and time again that again, putting these mandates in place was more detrimental to society as a whole than they were helpful at all. Now we have news coming from Nova Scotia. The COVID-19 vaccine mandates for Nova Scotia health workers should be lifted. This is something that this is not just Nova Scotia. There's many provinces, including my own province of British Columbia, where health workers are still off. They're still laid off. They're still fired without pay for having refused the vaccination. Halifax, Nova Scotia vaccine mandate, which has kept badly needed healthcare workers suspended without pay for more than a year, can no longer be justified, a Breton University professor says. If there were a public policy, if I were a public policy maker, I think I would be saying that I don't see a compelling body of evidence in front of me in February 2023 to renew this extraordinary policy, said Tom Urbanek, political science and public policy expert at CBU. I would insist continuously that advisors and the scientific community show me the latest body of evidence. It's now been 16 months since the Nova Scotia government put in place a policy requiring healthcare workers to have 2 COVID-19 vaccinations or provide a valid exemption in order to stay on the job. The Chronicle Herald has repeatedly asked the Department of Health and Wellness to provide the basis for keeping the policy in place, but has yet to be provided an explanation for what additional risks unvaccinated people pose in a healthcare setting. And well, again, these are the questions that have been raised time and time and time again by just members of the public, as well as medical professionals. And at the time during the pandemic, these people were crucified for what they had to say about this. Most of these people vindicated after all this time, and yet these policies still exist. And this is why this bureaucracy is just a horrible setup. Earlier this month, the Herald asked to speak with Health Minister Michelle Thompson or Dr. Robert Strang, the province's chief medical officer of health, or any other qualified department official, but the request was denied. Urbanek points out the policy, the COVID-19 mandatory vaccination protocol in high-risk settings, was put in place in October 2021 as an exceptional, urgent, time-limited measure. As such, there should have been a mechanism to review the policy perhaps every 6 months and to justify its renewal each time based on the very latest evolving scientific research and public impact analysis, he said. Some of the other jurisdictions that have lifted this requirement have insisted that the scientific evidence and the overall cost-benefit analysis pointed to it being the public interest to lift this particular restriction, Urbanek said. Nova Scotia is the only province in Atlantic Canada that still has such a requirement. Well, we have it in British Columbia, as we have here. BC nurses fight mandates. The website's still up, and I'll leave a link in the description for all the things that I shared today. But definitely, this is an issue that Canadians are still fighting across many other of these provinces. So many British Columbia nurses are fighting not only to have their jobs at home. Well, so many people are losing their practitioners as it is. We lost our family doctor recently ourselves because that doctor up and left. See you later. Tired of this province, or tired of whatever it was. Our family doctor had left, and we're now in the market for a new one. I wonder how long that will take. But this is definitely what's going on across Canada. As we see, they're telling people you don't even need these boosters anymore. This isn't even a requirement. They don't have the political will to push this forward into another mandatory ring of pushing boosters on people. The up-to-date mantra that Duclos had announced is largely unpopular, and I don't think that they're going to be going along with this. But as always, let me know in the comments down below what you think of this whole scenario. Other countries, even Japan, which has been a little bit late to the punch when getting rid of mask mandates. I know here a lot of people, it was largely like Canada in the days before the mask mandates were lifted, where people were just, some people complied, but most people either half complied or didn't comply at all. And that's just kind of what you see around here in Tokyo anyway. But as of the 13th of this month, there won't be any more of these restrictions here, even in Japan. So let me know what you think about this whole scenario. They spent a lot of our tax dollars on these boosters, and well, they're just not going to be able to use them. They're all going to go to waste. Like much of government spending, it all goes, well, majority of it goes to waste anyhow. Anyway, we'll see you in the next one. Keep on trucking.